Hi, everybody. So, welcome again to the Empowerment Series. And I have a wonderful guest with me. I'm really very excited to talk with her, Dixie James. She is welcome, Dixie. She is the regional president of Jefferson Health, the largest health system, I don't know, in Pennsylvania or the whatever it is. It's pretty huge and a pretty big deal. I I actually bumped into you at an event and said, um, one of my wishes is to have you on my empowerment series. So thank you for doing this. And I don't know you that well. I know of you as everyone knows of you. And all I see, and tell me if I'm wrong, is that you keep getting promoted. I don't know if it's taking on more or what's going on here, but it's obviously a compliment and well deserved. Um,
Thank you. Well, first, let me say thank you for having me. When we bumped into each other and you said that, I thought, well, of course, I would love to do this and spend time talking with Sue. You are certainly a icon in the region, and you have paved the way for many of the leaders, women leaders in the region. So it's an honor to be here. So thank you for inviting me, and having you say really nice things about me helps as well.
oh, that's awesome. And so really what we want to hear is, when was that moment that you bet on yourself?
Yeah, well, it's interesting because, like with everything, I think it probably goes back to your upbringing. I give my parents credit for the person that I've shaped into being both professionally and personally. I think one of the things, being a youngest child in an immigrant family, and also, two girls. My dad wanted a boy, didn't get his boy. I was his boy, so I
I
had
know my father, I have three sisters. My father insisted on a male dog. So that's just
yeah.
saying. So I get
My
it.
dad probably would have wanted that too. I think my mom vetoed it, but so I had to do double duty as the youngest and as the boy. And knowing, I guess, all along, being brought up believing you're gonna have to figure this out, and you have to make a way for yourself. And there's nothing that you can't figure out how to do if you tap your resources, you put your mind to it. And it sounds old school, but it really was instilled pretty early, that and the art that you have to, it's not about you and you have to help. And I've told the story before that, growing up, one of the things we did every quarter is our family got together, and we had to, on Saturdays, when we thought we were going out with our friends, we did this all through high school. We had to prepare meals that we would then give to homeless shelters. And my parents did that so that we would remember that there are people that are every day that are in need of things, and that we can be a solution to it. And so my solution mindset was always around, how do I not just get ahead, but how do I help people in the process? So betting on myself, to me, was always purpose driven. It was about doing good, but doing good, which the advancement has come as a result of it. But if I'm completely honest, my motivation has been really about how do I make an impact that was bigger than myself.
And so is that how you chose healthcare? That's why you're chair of Phil Abundance. I mean, so it's kind of, and you're like, hey, Dad, I'm a CEO, by the way. I
Right.
hope you're proud of me, right?
Right.
But so you sort of have checked all the boxes. And, you know, were there tough times to getting to the spot where you are now, or?
Yeah. I mean, I definitely think that I think about tough times differently, though. I think everything shapes you, right? And I mean, when I look back on it, I think maybe now I think, oh, that was a tough that was a tough
Mhm.
period of time you weathered. I think about COVID, and I think about even earlier in my career, I was always sort of the youngest, and maybe the only female, and maybe the only minority in the room. So all those trying to find your voice, trying to figure out how to add that value, was always a challenge, but only more so now when I look back. In the moment, it just felt like what you had to do, and you figure it out. And it shapes you, it gives you the skills that you need for that next step. And so you can't trade those tough earned moments where you're sort of going through it. And so I look back on them even and really appreciate them. I appreciate the journey with the bumps and bruises and the praise. I mean, I don't think you get it. I don't think you earn it if you don't have some of those and you don't go through some of those tests.
You seem to have this sort of wonderful presence about you. It seems very authentic, but very much, confident, but in a good way, not a braggy way. And is that just who you are? Does that go back to your folks? Is that, like you said, building those steps along the way and learning from others? What do you think? Or is that just you?
I mean, maybe it's me now formed. I mean, I think well, a couple of things. I like to say I'm a Sagittarius, so I'm the eternal optimist. I'm always the glass half full, thinking about what we can do better. But I also think that growing up the way I did, there was never ever any sense of entitlement. Like, I honestly feel like um, you have to work for things, and then you have to work for things bigger than yourself, and you have to contribute to a bigger picture and whole. So I believe that as a philosophy. It's what gets me out of bed in the morning, and I think so that drives me as a why, and that's then anchored in my faith. So I am very faith filled. I think sometimes when you go through seasons where you're not confident that you can do things, I never feel like I have to necessarily do it alone. I lean a lot on my faith and my family. So, it keeps me grounded. I never think I'm bigger than the job. I can't get anything done without the partnerships that I've created and the wonderful people that I get to work with and call family. And even the ones that, we fight like family sometimes. It's interesting during budget season. We're not always friends, but we remember that we're here for a bigger purpose. And that's what I love about healthcare. And that's why I do the things I do with, I've always looked for, even outside of the work I do in healthcare. The reason I ended up, on the Bill Abundance Board 9 years ago was looking for ways that I can have more impact in the work we were doing every day, recognizing there was a need in our patients that we were seeing at Einstein at the time, and knowing that they had greater needs than we were able to meet. And that's not our area of expertise. Food insecurities wasn't it, but what could we partner with to make a bigger impact? So it was using that as a driving force that led me to sort of seek out different partnerships. My stint on the American Heart Association board and chairing that was really about how do we do more? We know that there's a huge gap in our mortality rate in our communities and our zip codes, and we're fighting that. We're doing it when they end up in the hospital, but we know we need to go upstream. And what can we do? That's a big organization like American Heart. What can we partner with and do differently? So I guess that's what drives me, and I'm glad that it's authentic because it really is how I feel. I never have to show up as somebody else every day. I get to do what I love, and I get to do it in a way that brings me incredible fulfillment because it's hard work. And I don't know anyone that would do this unless they really felt like it's a 24/7 gig. So you got to really know that you're doing it for the right reasons.
I love that. Just one question you mentioned about, sometimes you have to, like in budget season, you have to not fight, but you have to, work on difficult issues. Like, how do you lead that way? What are your thoughts on that? Like, how do
Yeah,
you get through that?
yeah,
How do you negotiate? Any thoughts on
yeah.
what works for you?
Lots of thoughts on that. I mean, lots of years negotiating. I mean, because here's the thing in healthcare too, a lot of times we're not advocating for good versus bad, right? It's like best versus better. I mean, it's ranges of good things we're trying to do. And so the art of negotiation is really, for me, is to align my colleagues and our thinking on, we want maximum impact. I know at the end of the day that we have common ground on, we want the best care for our patients, and we want to make sure that we are doing absolutely the best we can to do. And so if I can find that common ground and then show them why my perspective gets us there. Then and clinically, financially, quality. I mean, you got to be comprehensive, obviously, as you're talking this through. I think people really want to do the right thing, and I think sometimes you do get sometimes folks that are anchored in their own personal perspective, but that's when you build consensus. So sometimes it takes, having some additional meetings and getting and pulling in a larger perspective to help sway or to help move a conversation along. But ultimately, you've got to find, and I also don't leave people without a win. So, if there's something we have to take off the table, I try to find a compromise that gives somebody a pickup. It may not be exactly what you needed, but where is the middle ground that we can compromise? So we know we're doing the right thing, and you're not walking away with anything. Let's figure out how we can make sure everyone gets something that they feel like is advancing the ball in their area.
So, what we're all hearing is very, very good common sense. Is that from experience, or is that you got it? You were born with it? Is it a combination? Is it, reaching out to people you admire, or what is it that gives you that EQ?
Such a good question. I think some of it is, upbringing and faith about being a good person and what does it mean to be a good person. But I also think I had I started my career really on the payer side, but we won't talk about that. Those are the dark days. I ended up in on the health system side very early in my career and in an area like strategy. And what that allowed me to do is, pretty much right out of grad school, very young, being in rooms, listening and absorbing conversations at the board level and very senior executives that were 20, 30 years my senior, and understanding their critical thinking process, their negotiation processes. I mean, I think I was able to absorb that very early in my career. And then because I was a early executive, being able to operate in that function, you just build on those skills. So I do think that some of it does feel like common sense, although common sense, my mom says, is not very common. So unfortunately at times. So I do think that the art of experience and really walking in it, which is why I think you just gotta sometimes you gotta pay your dues. And I'm a old school thinker that way, Gen Xer. I think you just gotta spend time and learn it. And I have great mentors that I tap into. I have my entire career. I've had mentors since the day I exited grad school, and I built on that. So I've got mentors and sponsors that I know I can pick up the phone and call when I'm wrestling through something that I really respect, that I know they'll give it to me straight. And that's important too, right? So I have been challenged to think differently. I've been challenged to confront things, and to use my voice. And the more you grow in your career, you realize that that's when it's most important to use your voice carefully, because everyone's listening. And that's when the EQ really needs to weigh in, because everyone's listening to you, and you can come down in a way that can be damaging. So being very responsible with that in your leadership role.
Terrific. And so that is the reason why we are all lucky to hear from you today. Thank you so much for doing this. I really,
Yes.
really appreciate talking with you, and
Have
thank
me
you
back
for your
anytime, Sue.
leadership. All right.
Okay.
Great. Thank you.
Thanks, Sue.